Well, the current approved indication for esophagogastric cancer in the U.S. is in chemotherapy refractory GE junction gastric adenocarcinomas with a CPS score of 1% or higher. So PD-L1 positive patients are eligible for treatment with pembrolizumab in the setting of chemotherapy-resistant disease, usually third-line treatment. So this was an important global study looking more at esophageal squamous cancer and adenocarcinoma. The predominant population on this study was squamous cancers, but adenocarcinomas were also treated. And this, in the subset of patients that had CPS score 10% or higher, there was a benefit for Keytruda in terms of response and potentially survival, which trended superior. They really didn't present the data for adenocarcinoma patients. It's a much smaller group of patients on this trial. Most of the patients on this trial were treated ex-US, a lot of Asian patients where squamous cancer is a more predominant histology. So I think based on really encouraging survival and response data as well as tolerance, pembrolizumab will likely be considered for approval of squamous cancers of the esophagus. Chemotherapy second line in these patients has very little benefit. In contrast to adenocarcinoma, where we have paclitaxel ramucirumab, we really only have paclitaxel or irinotecan alone as second line options and with really marginal activity. So I think the data would suggest a benefit, particularly in squamous cancers, CPS score 10% or higher. And we await updated analysis of the smaller group of patients that had adenocarcinomas.